Good afternoon. My name is Rebecca Creel and I'm with Gentiva Hospice in Enterprise, Alabama. And we're here today to discuss a little bit about hospice services and what it means to be a hospice patient. I have with me today Dr. Gary Allen, who is a medical director for Gentiva Hospice, and he is going to answer some questions for us today, and hopefully we'll come away with a better understanding of what it means to be a hospice patient. Dr. Allen, what is hospice care?
Becky, I think when we talk about hospice, I like to think about it in a way that in the medical community in the United States, we've always dealt with curing of medical problems, medical illnesses. Well, we know that can't be possible. Cure is not possible in every medical illness that we have. So in that situation, we know that people have terminal illnesses or are diagnosed with terminal illnesses every day. And those people still have symptoms. And with those symptoms, sometimes there becomes a lack of treatment in the past. Well, that's where I think hospice came in. Hospice recognized that those people at the end of life who've been given a terminal diagnosis, a very short lifespan maybe, still have symptoms. And because of that, hospice felt there was a need to give treatment to those folks at the end of life. I like to think about it as hospice as an organization that involves a group of very dedicated people who really understand that these individuals have symptoms at the end of life that need attention. When I talk about symptoms and we talk about hospice at that point in their life, we talk about hospice really looking at two phases. Two phases meaning symptom control, whether it be pain, nausea, vomiting, but also symptoms of getting the best quality of life that that person may be able to get at that time in their life. And I think the good thing about hospice too is that hospice doesn't only involve the patient. Hospice also involves the family. Hospice takes care of the family in that situation because there are needs of the family as well. So when I think about hospice, hospice is an organization that deals with the end-of-life care, treating symptoms, but also trying to give that patient the best quality of life that they can get at that point in their life.
Okay. All right. Well, who qualifies for hospice care?
When we talk about qualifications, we talk about eligibility of a patient for hospice. A big word, but we'll just say how they qualify for a patient for hospice. When we talk about qualifications, you know, anybody can be qualified to be in hospice. That's from an infant, unfortunately, that's been given a terminal diagnosis to the elderly who's been given a terminal diagnosis. But in the situations of qualifications, Medicare kind of has set the standard for us for the most part. And in the Medicare population, which is the biggest population of individuals in hospice care, we see that individual has to have Medicare Part A to qualify. That is a qualification that government has set forward. But more important than that is the fact that that person has to have a terminal diagnosis, unfortunately. And that terminal diagnosis means that that person should have a life expectancy of 6 months or less. Now, I think we all know that not all illnesses really end at 6 months. Some people have processes that end before 6 months. Some have processes that end after 6 months. So the 6 month is a very loose criteria. It all depends on the nature of the disease. So a person can be in hospice longer than 6 months and still maintain the care that hospice can provide. If we look at other insurance companies, and I'll just throw this in terms of Blue Cross, Medicaid, or even people who do not have insurance, those people can still be under hospice care. So they can still qualify for hospice. They just have to meet a certain criteria standard, some set forth by the specific insurance companies. But the primary common denominator is the 6 months or less life expectancy.
Well, let me ask you a question. A lot of times people think when they have been referred to a hospice service that means they're giving up hope. What would you say to somebody who thinks that coming on to a hospice means that there's not any more hope for them and that they're just giving up?
Well, I think that goes back to what I said earlier in terms of the medical community looks for a cure. And if you can't get a cure, then most of us think there's no hope. Well, hospice has a different philosophy. Hospice is not looking for a cure. Hospice is looking for symptom management and control of that patient in that latter stages of their life. They're looking for a situation where we can give that person have hope of a quality of life. That is, give them the best life that they can have in the short term that they may have left on this earth. But we also deal with the family. We also give the family hope that we can give their loved one the best care possible that we can give to them in that terminal stage. So hope, I think, in terms of cure is not what we look at. Hope in terms of quality of life and comfort control is what, as a hospice physician, that I look for. So I think that's hospice philosophy, and that's how we try to provide hope to that family of a situation that they can remember their loved one to be in the best condition they can be at that time of their life.
Okay. How does someone receive hospice services? How would someone go about getting in a hospice program?
That's a good question. We have a lot of misconceptions about hospice out there, a lot of myths about hospice that we have these days. But the basis of hospice is that we have to have a physician referral. Whether that comes from the primary care physician of that patient, their local doctor, or whether it comes from their doctor that's doing some of their, we call it subspecialty care, whether it's the, and I'll just say the cancer doctor, the heart doctor, the lung doctor, whoever it may be. We have to have that referral sent to us with that physician thinking that patient qualifies for hospice care. After we get that referral, then that will be reviewed to, number one, determine eligibility or if the person qualifies for hospice. After that's determined, then we'll go through a process of evaluations by the hospice personnel. There will be home visits, evaluations done, and then after that, it will come back to me as a medical director to see if I agree with that, if the person meets the specific criteria. If they meet the criteria, then that person is felt to be eligible for our hospice program. The misconceptions that we see sometimes, that we hear a lot of times, has to do with the patient has to be bedridden. The patient can't get out of the home. I can't go back to my local doctor. I can never go to the emergency room. Even though we discourage that because we think we can provide the care in the home, the patient can still receive those services if they so desire. So we like to try to dispel some of those myths as we can, and I think that's the purpose of us doing this talk here today.
Right. Now, a physician referral would be our number one way of receiving a referral,
Right.
but family members can also call in referrals to hospices. Is that true?
That's true. Family member can call. We still have to have the agreement or the okay of hopefully two physicians, but we can have a referral from the family. We can have a referral from a friend, basically. And the other thing to mention too is that it doesn't matter where the patient is. The patient can be in a nursing home setting. The patient can be in a skilled services setting. They can be in an assisted living facility. Wherever they call their residence at that time, that person can be on a hospice program if they meet the other criteria.
Well, Dr. Allen, I thank you for being with us today, and to all of you that tuned in with us this afternoon, we appreciate you listening in and learning more about what hospice means in our community. If you have any questions about hospice services, you can be in contact with us on the website or the telephone number that is showing across the screen at the bottom, and we hope you have a wonderful